Today we're picking up where we left off on part 2 of the appendicular skeleton. We're going to pick up with the pelvic girdle. Here with the pelvic girdle, you're going to have the coxa, which is going to be one side. Sometimes it's referred to as the coxal area. With this section, it's going to be several bones that are fused together. Your first bone that you see up top is going to be the ilium. So that's this major portion of this bone through here. With that bone, I guess the most prominent portion that you can actually feel on some people is going to be this iliac crest. That's going to be what we refer to as the hip bones that you can feel. Then coming down, you will have what's referred to as the ischium. And then in this region through here, you'll have what's called the pubis. So let's get rid of some of that really quick, so we can continue to look at what we're talking about. All right, notice in the center, you're going to have the sacrum, and then you'll have the coccyx further below where you can't see it. In between each one of these coxa, you're going to have a slightly movable joint. It does not move a lot. The only time it really actually moves is going to be when a woman is pregnant. It's going to loosen up a little bit to allow the baby to fall into the birth canal better, or go into the birth canal, so it kind of widens the hips there. And that's referred to as the symphysis pubis, or depending on what book you're using, sometimes it's called the pubic symphysis. Next thing we're going to look at is going to be this large foramen right here. That's referred to as the obturator foramen. That's going to be one of the largest foramens in the human body. Now coming on down, you see that ischium there. So if somebody's sitting on your lap, or you have a small child sitting on your lap and you say, oh, your tailbone is digging into my leg, actually that's going to be that ischium there. Looking at it closer, looking at each coxa or each side, the side to the left is going to be facing in towards the inside of the body, or facing in medially. That is facing the sacrum. And so you'll see that iliac crest on top. You see the ilium, then you see how the bones are divided up. You've got your ischium, the ischial spine sticking out, and you have your pubis. You also see that obturator foramen, which is going to be that large hole that's going to be found in that pelvic girdle. Coming on over to the side that faces outwards, or the lateral side, you see that ilium and the iliac crest again. Now you have a larger indention. This is going to be where the head of the femur comes in, and it's going to be referred to as the acetabulum. And so that is the circular section right here. That's going to be where the femur articulates with the coxa. Then, of course, with the ischium, we saw that ischial spine there, and you have your ischial tuberosity. Now, looking at the pelvis here, there's going to be several different ways that you're going to be able to tell the difference between the pelvis of a male and a female. The hips are going to flare out more, as you can see here with the female versus the male. They're going to be more up and down. One of the main ways, a really quick way for you to be able to tell, is to look at this pubic angle, or sometimes referred to as the pubic arch. If it's 90 degrees or less, then it tends to be a male. So if it looks like a V, it tends to be a male. If you look at it and it's going to be 100 degrees or more, or open more like a U or a rainbow, then that's going to tend to be a female. So look at it really quick, and that's a very quick way that you can guesstimate if that's going to be a male or female pelvis. Now, there are some variations. Sometimes it's a little bit harder to tell, but in most cases, this is a quick way that you can look at the pelvic girdle and tell male or female. Going on with the ilium, like we said, you're going to have those higher hips in a male. They're going to be more up and down, kind of like a cup shape for that pelvic girdle. With the females, it's going to be more open and wide, more of a bowl shape, and that's going to allow for the fetus to fit inside of that pelvic region. The sacrum in a male is going to be long, narrow, and triangular with a pronounced sacral curvature. In a female, it's going to be more broad. It's going to be short triangles with less of a sacral curvature. You don't want it to curve in as much if you're going to have a baby in that region, in that pelvic inlet there. Coming on down, you have the iliac fossa. It's going to be deeper in a male and shallower in the female. With the pelvic inlet, that's going to be inside, and that's going to be, with the males, it's going to be more narrower. And with females, of course, it needs to be more open to be able to accommodate the baby that will be there, or the baby that they may carry that can be in that area. The pelvic outlet, male is going to be narrower again, and female is going to be wider. The coccyx, which is considered to be the tailbone, is going to point anteriorly for the male and point inferiorly for the female. The acetabulum is going to be directly lateral with the male and is going to face slightly anteriorly with the male. So the legs face kind of inwards with the female. It kind of looks like they're walking knob-kneed or whatever, because the way our hips are made, our legs don't point straight. Next, the obturator foramen, more of an oval for a male and more triangular for a female. With a pubic angle or pubic arch, we just talked about that, less than 90 degrees or 90 degrees for a male, 100 degrees or more for a female. Other, you can look at the bone mass and density. It's going to be thicker and heavier with the male and less for the female. And bone markings are usually going to be more prominent for a male and less prominent for a female. And like I said, these are just generalizations. With the bone markings, remember, they're usually attached to ligaments and tendons and things, so they have a lot of pull on them. So with males, lots of times they tend to have more muscle mass. They tend to do a lot more activity and things that would pull on those bones, so it makes those prominences and those markings more pronounced than someone who does not do as much. All right, looking in a little bit further, we can look at the pelvic brim. That's something that you need to know. So a brim is what comes around here. Another thing that you need to know is the true pelvis and the false pelvis. So true pelvis goes from brim to brim, and false pelvis goes from crest to crest. So false pelvis across here, true pelvis inside. So you need to know the difference. Crest to crest, false. Brim to brim, true. Also, look at your sacrum, how you have that sacral curvature in there. Notice how you have the sacral prominence coming up through this section. And you have the symphysis pubis or pubic symphysis. And you have that pubic arch going through there. So notice with the one on the bottom, B, is going to be a male pelvic girdle. A on the top is going to be a female pelvic girdle. Also, you can tell differences in a skeleton by looking at the skull. So in general, with the general appearance, males are going to have a heavier, rougher skull. Females are going to have a lighter, smoother skull with smoother features. The cranium is going to be about 10% larger for males and about 10% smaller for females. The forehead's going to have more of a slope for males and be more vertical for females. The sinus cavities are going to be much larger in males and smaller in females. The teeth are going to be larger for males than for females. And the mandible, which is going to be the jaw, is going to be larger and more square and robust for a male, and smaller and narrower and less robust or more smoother looking for females. This is the femur. This is going to be the thigh bone or the upper leg bone. This bone is going to be the heaviest, the strongest bone in the body. It's carrying all of the weight of the upper portion of the body. Starting out with the top here, we see the head of the femur. That head's going to have a little indentation. It looks like a little hole there. You might notice on your skeletons in class. It's called the fovea capitis. You need to know that. You also need to know the head. Next, you have what's called the surgical neck, which comes around this area here. Then this section here is going to be called the anatomical neck. So it has two necks on there that you need to know. Looking up top, you're going to have what's referred to as the greater trochanter. And on the bottom, you have the lesser trochanter. And I'm using it from this view. This is the posterior view simply because it's easier to see on this one. Coming on over, like we said, we have the head. You would have a fovea capitis in that center part. You have this surgical neck. You have the anatomical neck. You see the greater trochanter here, and you see the lesser trochanter here. Coming on down, this, like I said, is going to be your anterior. And this side is going to be posterior. And so looking from the anterior view, this right here is going to fit in, this head part is going to fit into the acetabulum of the pelvic girdle. Then coming on down, you're going to have this smooth section, which is the patellar surface. It's going to actually have the patella joined with ligaments. That's going to be over top. So your patella is going to be your kneecap. You have the lateral epicondyle, so lateral means to the side. Then you have your medial epicondyle, and of course medial means towards the middle. And if you turn around and look at it from the posterior view, then you'll have your condyles. And so the medial condyle, which is towards the mid-center of the body, and then you have your lateral condyle, which is towards the side of the body. Those are the things that you need to know for the femur. Now we're going to the lower leg. Starting off, we have the tibia, which is going to be the shin bone, and the fibula, which is going to be the side bone. So tibia is going to be medial, fibula is going to be lateral. So depending on what leg you are looking at, the fibula is always going to be on the outer side of that tibia. So the top portion of the tibia is what's going to articulate with that bottom portion of the femur, and then you're going to have that smooth patellar surface where you'll have the patella. You'll see a lateral condyle, so that's towards the side. You have a medial condyle, which is towards the mid-center of the body. You have a prominent ridge that sticks up through that center there. That's going to be a tibial tuberosity. Then you have what's referred to as an anterior crest, which will come down the center of the tibia. You have the main section of the tibia, which is going to be the body of the tibia or the shaft. And then you come down and you'll have the medial malleolus. Going to the fibula, you have the head of the fibula. You have the body or shaft of the fibula, the diaphysis. And then you have the lateral malleolus. Looking here, this is going to be the patella, so this is your kneecap. The base you often think of as being the bottom, but not in the case here with the patella. The base is going to be the upper portion of the patella. Then the bottom portion, which comes to a point, is going to be the apex of the patella. Notice here how you have this prominence coming up. That's going to be an attachment area for the quadricep tendon. So the muscles in the thigh are going to attach there at the patella. This shows you how the patella will sit against the femur here. And so you have the indention, so that would be that patellar surface there. And then it's kind of a lateral facet that you see where it sits against it. And then, of course, you have your condyles on each side. So you know this is facing toward the midline of the body, and this will be facing towards the lateral or side of the body. Coming on down to the foot, first we're going to go over our tarsals, which are our ankle bones. You're going to have 7 ankle bones. You have the calcaneus, which is going to be this main bone through here. That is the heel bone. You have the talus, which sits through this section here. You have from this view, this is going to be on the midline or inner part of the foot. I know that because I see this bone here, which is the navicular. and you see this bone here, which is the medial cuneiform. Next, you're going to go to your metatarsals, which are kind of like your metacarpals, and then the phalanges, which are going to be the toes. So looking at it from a top view, you have that calcaneus, which was that heel bone underneath, the talus, which comes through here. Always start from the inside and work my way laterally or across. I look for this rectangular shaped bone here, the navicular. Beside the navicular is going to be your cuboid, and then you come down and you have the medial, the intermediate, and then the lateral cuneiforms. Next, you're going to look at the metatarsals. Notice that you're starting with the midline or middle of the foot when you number them. So the one that's connected with the big toe or great toe is going to be metatarsal 1. Then you have metatarsal 2, 3, 4, and then 5 with the pinky toe or little toe. Now, another name for the big toe is going to be the hallux. So we had the pollex for the thumb. Now we have the hallux for the big toe. So remember, pollex, thumb, hallux, big toe. Now we're going to come over and talk about the phalanx in the phalanges. And so you have the proximal phalanx, which is going to be closer or more proximal to the body. You have the middle phalanx, and then you'll have your distal phalanx. So those are your phalanges. Okay, so notice with the big toe or with the hallux, it's only going to have 2 phalanxes. It's going to have the proximal phalanx, which is going to be the one closer to the foot, and it's going to have that distal phalanx. And so that's going to make up the hallux or that big toe. This is where we're going to end this section. We have finished out our appendicular skeleton. And with our next unit, we will move on to muscles.